Hello, everyone, and welcome to our presentation on vaping, e-cigarette-related diseases. The presenters are myself, Barbara Ifani, Megan McDevitt, Blessing Mweke, and Rosa Parker. All of us are family nurse practitioner students at Wagner College.
Hello, my name is Megan McDevitt. I will be exploring the learning objectives today. The overall objectives of this presentation are to increase the understanding and knowledge on vaping. As healthcare providers, it is essential that we appreciate the health risks associated with this disorder. In 2019, the Centers for Disease Control and Prevention investigated a sharp increase in hospitalizations related to vaping problems. The patients had respiratory symptoms and all shared that they had used vaping products in the last 3 months. The condition was named E-Valley, which stood for e-cigarette or vaping product use associated with lung injury. The objectives for this presentation are to define vaping, discuss the prevalence and trends of vaping use, explore the harmful effects of vaping on the respiratory system, evaluate symptoms and diagnosis of vaping-related illness, recognize the side effects and management of vaping cessation, and understanding resources available to healthcare providers.
So this is Barbara Ifani again. I'm going to be talking about definition of vaping followed by prevalence and trends. So definition of vaping. Vaping is the action of inhaling liquid nicotine or using an electronic cigarette. Electronic cigarettes, which can be used to deliver marijuana and other drugs, are officially termed electronic nicotine delivery systems, or ENDS. Though some commonly used names include e-cigs, vapes or vape pens, mods, tank systems, or e-hookahs. E-cigarette produce an aerosol by heating a liquid that usually contains nicotine, the addictive drug in regular cigarettes, cigars, and other tobacco products. Some e-cigarettes look like regular cigarettes, cigars, or pipes. Others resemble pen, USB sticks, or other everyday items. This can be visually appealing to tech-savvy teens. Users inhale this aerosol into their lungs, where it can cause damage. Bystanders can also breathe in this aerosol when the user exhales it into the air. Like secondhand smoke, secondhand vapor is harmful. Youth vaping is at a crisis point, which threatens to undo years of public health efforts that has reduced tobacco use. Many teens and adults view e-cigarette as a harmless flavored vapor without nicotine content, which is a myth. It is necessary for experienced healthcare providers like us to create awareness of the health risk associated with vaping, highlight the harmful substances in e-cigarette, and clarify existing misconceptions surrounding e-cigarettes. Although smoking is more harmful than vaping, e-cigarettes are still harmful because the aerosol emitted contains harmful substances, including nicotine, heavy metals, lead, tin, nickel, ultrafine particles, and diacetyl flavoring. If you look up, you'll see all the harmful contents in nicotine. So clearly, nicotine is not safe. It is harmful. Ultrafine particles in e-cigarettes can cause scarring of the lungs. When inhaled, while diacetyl flavoring have been associated with many serious lung diseases. Nicotine is a drug found in tobacco plants, and it's highly addictive. When absorbed, nicotine activates areas of the brain that makes a person happy and satisfied, which can lead to addiction as the person constantly craves this feeling. Repeated vaping can lead to the same risk for addiction to nicotine as cigarette smoking. This makes vaping a serious public health concern. Nicotine exposure through vaping can cause A, impaired brain development, B, impaired learning, memory, and attention, which can continue through ages early to mid-20s. Acute nicotine exposure is toxic. In fact, children and adults have been poisoned by swallowing, breathing, or absorbing e-cigarettes liquid through their skin or eyes. So now we look at prevalence and trends of vaping among American youths. E-cigarette entered US market around 2007. And since 2014, they remain the most commonly used tobacco product among US youth. In 2020, 19.6% of high school students and 4.7% of middle school students used e-cigarettes, with pre-filled pods or cartridges cited as the most used device type. Between 2019 and 2020, disposable e-cigarette use increased from 2.4% to 26.5% among high school e-cigarette users, and from 3.0% to 15.2% among middle school e-cigarette users. So we can see that the trend of vaping among the youth is trending up. It is not trending down. About 3.6 million US youth reported e-cigarette use in 2020. Majority of e-cigarette users use flavored e-cigarette, and this includes high school and middle school users. Flavoring in particular can be very enticing to young people, and this can create an illusion of safety. The most common flavors include fruit at 73.1%, mint at 55.8%, menthol at 37.0%, and candy, dessert, or other sweets at 36.4%. The most popular is Juul, with 600% surge in sales from 2016 to 2017. Juul is shaped like USB stick and has liquid refills called pods. These pods come in flavors including mint, creme brulee, fruit medley, making them particularly appealing to adolescents. Again, we see the advertising geared to entice teens who are very young and might be enticed by flavoring and designs that are so appealing. So on the next part of this slide, someone might ask the question, is vaping only affecting youths or adults also affected by vaping? Another question could be youth versus adults, who vapes more? So e-cigarette use among US adults is more than double that of the youths, as evidenced by an estimated 8.1 million adult users in 2018. Some adults may use vaping as a means to quit cigarette smoking, but e-cigarette is not FDA approved as a quit smoking aid, at least not as of yet. In 2018, e-cigarette use was highest among non-Hispanic white adult males aged 18 to 24 compared to other ethnicities. Also, vaping among males at 4.3% almost doubled usage among females at 2.3%. When you look at the bar graph on the bottom of the screen, you can clearly see that the most prevalent population that vape the most is non-Hispanic white males 18 to 24 years old, which is a high prevalence in this group. However, a careful look at this graph also shows that in general, vaping is highly prevalent. It affects all the age groups, including 18 to 24, 25 to 44, 45 to 64, and even some 65 and older. It also affects many ethnicity: Hispanic, non-Hispanic white, non-Hispanic Black, non-Hispanic Asian. So even though the most prevalent group is 18 to 24, non-Hispanic white males, the prevalence of vaping in general is high, and this makes this a serious public health concern.
Hello, my name is Megan. I will be talking about the symptoms, description, or other ways of evaluating and diagnosing vaping-related health problems. Diagnosing E-Valley may be challenging. Symptoms are similar to other respiratory illnesses, for example, flu and pneumonia. Presentation of symptoms may include shortness of breath, cough, fever, chills, diarrhea, nausea, vomiting, abdominal pain, tachycardia, and rapid shallow breathing. There is no single test for diagnosis of E-Valley. Vaping-related diseases are determined by diagnosis of exclusion. Providers will need to conduct a thorough history, assess vital signs, and complete a comprehensive physical exam. Imaging studies and lab work may also be necessary. When a person smokes, the liver metabolizes nicotine and turns it into cotinine. Cotinine is a chemical metabolite that lab technicians look for when screening for nicotine use. Cotinine can be measured by testing the urine, blood, or saliva. Chest-computed tomography scans obtained from patients with vaping-associated lung disease have shown significant findings. Ground glass opacities are a common finding in the imaging studies of most patients with e-cigarette-associated lung disease. The graph shown in this slide illustrates some important information on vaping. As noted on this graph, vaping can be done by use of a vape pen or a pod device. The effects of vaping are manifested in the pulmonary and cardiac systems. These short-term consequences to the pulmonary system include increased flow resistance and increased airway reactivity. When airway resistance is increased, air can become trapped in the lungs, limited gas exchange, and in severe cases can cause respiratory failure. This is characteristic of asthma. Research supports that vaping increases the risk of chronic diseases, including asthma. Evidence shows that vaping can alter the body's immune system in a way that increases a person's vulnerability to asthma triggers. The other short-term consequence, which is airway reactivity. Individuals with EVALI can present with varying degrees of lung injury and may show pronounced airway hyperactivity. The long-term pulmonary effects are emphysema, higher airway resistance, airway obstruction, and airway inflammation. Science has proven that chronic low-grade inflammation can progress to be a silent killer that can contribute to cancerous, cardiovascular disease, and other conditions. At present, it is not entirely clear how often vaping may lead to lung disorders. For example, it is more common among individuals who already have respiratory disorders or who use marijuana or regular cigarettes. The short-term and long-term consequences to the cardiac system include increased heart rate, blood pressure, and increased aortic stiffness. The long-term consequences are increased atherosclerosis and again, aortic stiffness. As illustrated, vaping can have both rapid and long-term effects on the arteries. Vape users may be more likely at risk for coronary artery disease. However, long-term studies are needed to further examine the cardiovascular risks associated with vaping.
Hello, this is Blessing Nowicki, and I'll be presenting our portrait survey. So we created a portrait survey to collect data from our classmates on their knowledge of vaping-related health problems. After our initial survey, known as our pre-test, we did a PowerPoint presentation on the issue following an exhaustive literature search. To evaluate the effectiveness of the knowledge gained from our presentation, a post-test data was collected. There were 11 survey questions, of which the first 3 is to assess their personal history of vaping. Of all the students that responded, 100% reported having vaped or knowing someone that vaped. Another 81.8% acknowledged daily vaping or knowing someone that vapes daily. 45.5% of those that vapes stated that they started vaping between the ages of 18 to 24 years. So the following 8 questions were included in our survey. What is vaping? Who engages the most in vaping? Smoking is more harmful than vaping, true or false? In the year 2020, what was the prevalence of e-cigarette smoking in the United States? Lung diseases associated with vaping are nicotine exposure in adolescents through vaping can cause which of the following mental health problems? What condition is associated with vaping cessation? And finally, what is one of the ways to manage vaping cessation? So on the first question of the definition of vaping, 72% of respondents got the answer wrong, while 27.27 correctly defined vaping. On question number 2, 90.9 actually correctly answered that white men between the ages of 18 to 24 vape the most. On question number 3, surprisingly, 72.7 believe that smoking is less harmful than vaping. while 27.7 correctly answered that smoking is more harmful. On question number 4, on the prevalence, only 18.18 answered correctly, while 81.18 got the answer wrong. On our question number 5, over 90% listed all lung diseases associated with vaping. Another 90% correctly identified all mental health problems associated with vaping. That was question number 6. On question number 7, 100% of our respondents knew that vaping cessation causes a nicotine withdrawal syndrome. Finally, on the last question, 87.8 correctly identified cognitive behavioral therapy as the best approach to managing vaping cessation. So I'll talk about the post-test survey. So a post-test survey was given after a PowerPoint presentation to determine what the students have learned. Just like in the pre-test, 11 questions were included, of which the first 3 are to validate their personal history of vaping. And also 11 students responded to the question. On question number 1, an overwhelming number of students, 81.82%, correctly identified the definition of vaping, compared to 27.27 on the pretest. This suggests that a positive change in knowledge following a PowerPoint presentation. On question number 2, 81.82% of respondents identified white men between the ages of 18 to 24 as the population that vapes the most. This is actually less than 90 that answered in the affirmative in a pretest survey. This decline suggests a little less than optimal knowledge deficit by the students as to the target population for intervention. On question number 3, there was a net gain of 9% in knowledge on the question about the harmfulness of smoking compared to vaping. Pretest was 36.36% and post-test was 45%. On our question number 4, there also exists a net gain of 27.28% in knowledge on the question of prevalence. Pre-test was 36.36% and post-test was 63%. Surprisingly, on question number 5, there was a decrease of 18.17 that correctly identified all the lung diseases associated with vaping. 72.73 post-test compared to 90.9 pre-test. This suggests an area of an ongoing knowledge deficit. So results from our post-test suggest that most students have prior knowledge of mental problems associated with vaping. They also have prior knowledge of vaping withdrawal syndrome, as well as ways to manage vaping cessation. This is demonstrated by the fact that the same percentage of students correctly identified the questions in both pre-test and post-test survey. The numbers are 90.91, 100%, and 87.8% respectively. The above survey result reveals that for some questions, students' performance at the pre-test is actually better than their performance at post-test, although not determined to be statistically significant. However, several questions show the opposite and desired effect. That is that more students answered correctly at the post-test than at the pre-test. Finally, in some questions, their knowledge stays the same.
Hello, everyone. My name is Rosa Parker. I will be discussing the current treatment for vaping, prevention and awareness to slow down the increase of people vaping, as well as the recommendations and tools available to healthcare professionals to help manage the increase in vaping. In my research, I came across some of the current treatments used to help with the treatment of vaping. The first one I will discuss is the nicotine replacement therapy, which is considered a first-line treatment for most people who want to make a make a quit attempt. And it is available over the counter for adults or by prescription for children under the age of 18. Nicotine patches are often used and as a starting medication because they deliver a constant level of nicotine, avoiding the peaks and troughs of nicotine that come from vaping or smoking. Patches can be combined with a second form of nicotine replacement, such as gum or lozenges, to be used as necessary to combat breakthrough cravings. Prescription medications such as bupropion, also known as Wellbutrin or Buspar, and Chantix are available for people who have difficulty quitting even with nicotine replacement. Medication treatment for nicotine use disorders should always be supervised by a healthcare professional for children under the age of 18. This applies to NRT, which is only available by prescription for teens. Supportive counseling is also another method of current treatment use. Supportive counseling, behavioral counseling is a mainstay of treatment for substance use disorders and can help people quit. Quit lines and digital tools are available and can be very helpful, as can individual or group therapy. Combination treatments also are used in addition to providing prescription medication. Healthcare providers can connect patients to additional resources, which is especially important for patients who have developed physical problems such as breathing issues or changes such as new or worsening difficulty with concentration or focus. Prevention and awareness to slow down the increase of people vaping. According to the American Heart Association, some approaches that have worked to prevent or slow down the progression of vaping are raising e-cigarette and cigarette prices. Most teens are sensitive to pricing. High prices can dissuade them to maybe not start smoking once they see the prices are a bit higher than they can afford. That may work to dissuade them from starting to vape. Restricting access. The American Heart Association advocates for adopting e-cigarette tobacco 21 laws nationwide, setting a minimal legal sale age at 21 for every state. Another is limiting e-cigarette tobacco marketing. Regulatory initiatives that ban youth-focused marketing efforts have helped curb smoking's appeal to young people. The one other is parental influence. Parents can steer their kids away from tobacco vaping by starting speaking to them about it at an early age, even from kindergarten. Just talking with them about smoking and vaping and being mindful to be honest and open to seeing things from the child's point of view and to continue to keep the conversation going as the kid gets older. Thinking more than just cigarettes when speaking to the children. Explain that smokeless tobacco, hookah, and e-cigarette all have dangers and are addictive. Also discuss peer pressure, what they might say if a friend offers an e-cigarette or a cigarette. Set a good example. If the parents smoke in the house, they should consider smoking and not smoking around the children. If they need to, they can go outside, and don't allow family members or friends to smoke in the house or the car. And just make sure the places your child spends a lot of time is tobacco free. Conducting media campaigns, education campaigns such as True Initiative have helped teens understand how tobacco companies exploit them. These campaigns are even effective when supported by school-based and family-based programs. Last but not least is providing quit smoking programs. Affordable and accessible smoking cessation programs can help young smokers quit, as well as parents and caregivers who want to model healthier behavior. Recommendations and tools available to healthcare professionals to help manage the increase in vaping. This is something I came across that I thought was interesting, mostly geared to our healthcare providers. The saying is, as healthcare providers, of course, we play an important role in addressing this epidemic among youth because they come into the clinics. You know, we have the opportunity, just to screen them, ask them certain questions about tobacco and about the use of the e-cigarettes and the vaping. Learning more about the different shapes and types of e-cigarettes and risks of e-cigarettes used for young people, and just be prepared to educate patients about the risks of tobacco product use, including e-cigarettes. counsel the youth and young adults to quit and offer resources for vaping, smoking cessation. The vaping toolkit that has been created to help healthcare professionals explain to others what is in a vape. It is a collection of creative assets that can be used when working with young people at ages 14 to 17 years. The vaping toolkit aims to increase awareness around vapes and the health risks of vaping. It also addresses the myths and misconceptions about vaping. In addition, the vaping toolkit the user guide provides information on the purpose of the vaping toolkit and how it can be used. The FDA Center for Tobacco Products announced the launch of the Vaping Prevention and Education Resource Center. The online resource center provides science-based standard map materials that teachers can use to help their students understand the dangers associated with vaping and nicotine addiction. The new resource center features numerous age-appropriate cross-curricular resources for teachers to promote learning and begin having open conversations with youth about vaping. Additionally, CTP developed materials for parents and teens. All content on the Resource Center is free, is easy to navigate, and optimized for each audience. The launch of the Resource Center illustrates FDA's continued commitment to youth vaping prevention. CTP will continuously update the Resource Center with new materials. For further information on vaping, here are a list of links that you can go to, websites you can go to read more about it.
Hello, my name is Megan. I will be explaining the impact of vaping both locally and worldwide. The first graph shows the number of E-Valley cases reported in each state as of 2019, reported by the CDC. According to the statistics on this map, California and Illinois lead with the most E-Valley cases at 100 to 149. The data supports that in New York, there were 50 to 99 cases. Patients using vape products can be encountered in any healthcare setting, so all patients should be screened accordingly. The second graph shows data on individuals and vape use. The blue bar shows the statistics of ever tried, the green bar for current use, and the purple bar is daily use. The US leads the way for the highest percentage of ever tried at 57.5, and current use at 7.1 is high as well. It is interesting to note that the US is noted to have less restrictive policies. England has a high current use at 7.4, and similar to the US, has less restrictive policies. Malaysia has less individuals who have ever tried vaping, but the most individuals with current use at 11.6. Data was also collected related to income classified as high, upper middle, and lower middle. Countries such as Bangladesh and Zambia, both cited as lower middle income, have very low rates of vape use. Depending on how much a person vapes will determine the financial cost. The cost can range from hundreds to thousands of dollars. There is also differences in disposable pens versus those pens of higher quality and advanced features. Of course, states and countries can and do impose taxes on vaping products. However, we must understand that high taxes on vaping products can push individuals back to cigarettes, so this should be considered as well.
This is Barbara Ifani. We want to thank you for participating and in listening to our presentation. We hope that you enjoyed this presentation, and we hope that you have gained more knowledge than you previously had regarding vaping and all the related health issues that is associated with it. Thank you so much and have a good rest of your day.